Cancer. Lung cancer is the #1 cancer for both sexes in this country. Following that, then comes prostate and breast cancer. Cancer costs about $107 billion annually to treat in this country alone. The nice thing about it, though, is that death rates are down 2.1% approximately for every year since 1993. So we are making progress against cancer. Now, cancer in and of itself is an umbrella term. It's just a term that used to identify a large group of diseases that involve uncontrolled cellular growth, destruction of healthy tissue, and risk of death. 1 out of every 3 Americans develop some form of cancer, and that incidence will increase with age. 52% of all cancers occur after age 65. Benign tumors. Benign means that it's good, or it's not bad. It has the suffix of OMA, OMA. It generally does not kill the host, but it can be life-threatening if it's located somewhere in which it causes problem. For example, a tumor of the pituitary gland can put pressure on the brain. A brain tumor can also put pressure, causing herniation and death. So it does make a difference on the location that causes it to be life-threatening. Many tumors, benign tumors, are encapsulated by connective tissue. That's one reason it does not spread. Benign tumors tend to resemble more closely the tissue of origin than not. And some benign cancers can progress to malignant cancer, but that's fairly rare. But some examples of benign tumors might be a leiomyoma, which is a fibroid tumor of the uterus, or a lipoma, which is a fatty tumor. Malignant cancer, on the other hand, has a suffix of noma, N-O-M-A, or sarcoma. If it's left untreated, it will kill the host. It invades adjacent cells, blood vessels, and lymphatics. It spreads to distant sites. That means metastasize. And to be able to metastasize, it means it has the ability to spread by way of the blood, the lymph, or by local invasion. If it's unencapsulated, it may directly invade the adjacent surrounding tissue. It causes a loss of differentiation so that the cells of the malignant cancer look less like the cells of the primary tissue. There is no capsule around them, and they have anaplasia. Now, ana means without cells, so in other words, it has a loss of differentiation. The nucleus is irregular looking. It has a loss of your normal tissue structure. It's very different looking from the cell of origin. Cancer cells have an uncontrolled growth pattern. Now remember that normal cells only grow when anchored somewhere. Cancer cells don't have to be anchored. They have a disorderly growth. They'll have variation of cell shape and size. You'll have a local increase in the cell number with loss of the normal arrangement of the cells. You'll have an increase in the nuclear size, and you'll have staining that occurs. So you'll have an increase in DNA. The nuclei are larger and irregularly shaped. You'll have an increase in mitotic activity, so you'll either have a diminished or absent resting phase in the cell cycle. You'll have abnormal mitoses and chromosomes. They're considered anchorage independent. In other words, they're missing that anchoring junction which attaches cells together. So because they're missing that, these cells travel faster, further. You have increased transport and increased metastasis. Cancer cells have lost or modified surface glycoproteins and lipids. Thus, the lipid and protein content in the cell is low, resulting in cells that are more responsive to growth factors. There's also a decrease in communication between the cells. Tumors are classified by their cell type. As I said, they have a suffix of oma attached to the tissue of origin. The tissue of origin is your primary name. So it could be like carcinoma is a malignant tumor of epithelial origin. A sarcoma is a malignant tissue of connective tissue, a malignant cancer of connective tissue. A lymphoma is a tumor of the lymph. A glioma is a tumor of your nerve cells. Leukemia is a tumor of your blood-forming tissues, primarily bone marrow. Rhabdomyosarcoma, you take it apart. Rhabdo meaning skeletal, myo meaning muscle, and sarcoma meaning connective tissue. So it's a tumor of your skeletal muscle. There's a table on page 225 that lists examples of nomenclature for different tumors, and you should know those. The classification is also by differentiation. How similar is it to the parent tissue? Where's the anatomic site? For example, a carcinoma in situ is right at that same site. It's spread nowhere else. It's right there. What's its function? Now, ADH is your antidiuretic hormone that's usually secreted by your posterior pituitary, but it can also be secreted ectopically by a lung tumor, and that is one of the primary symptoms that you have lung cancer. Carcinoma in situ is a cancer of your pre-invasive epithelial tissues, of your glandular or your squamous cells. Now, your squamous cells occur mainly in your skin, your cervix, your oral cavity, your esophagus, and your bronchus. Your glandular cells occur mainly in your stomach, your endometrium, your breast, and your large bowel. If it's discovered at this time, if the cancer is discovered when you're carcinoma in situ, recovery is almost a certainty. The test that is done to diagnose cervical cancer, ladies, is called a pap smear. And a pap smear is done to scrape the cervix to look to see if there are any pre-invasive epithelial cells there. Okay. Tumors are graded. The higher the grade, the greater the malignant potential. This is used to predict the clinical behavior of the tumor. So if they're a grade 1, they're most like the parent tissue. They have malignant cells with minimal differentiation. Again, the easiest way to fix them. They can prevent the problem from spreading, and this is the grade you want to be in if you have to be in. And it can go all the way up to a grade 4. Now, grade 4 is very poorly differentiated. There's no resemblance to the tissue of origin. Grade 2, moderate differentiation. Grade 3, poorly differentiated, much variation in cell size and shape, but it's still not as bad as a grade 4. There's also a way to look at the TNM scale. And this is looking at T is the tissue involved, N is the number of lymph nodes, and M is the degree of metastasis. There is a box on page 225 which discusses the grading scale for cancers, and the figure on 226 shows you the differences in the TNM scale. So you'll want to look at both of those. Cell differentiation. Again, the tumor cells exhibit various degrees of resemblance to the parent tissue of origin. You want it closest to the parent tissue of origin in order to have the best prognosis. Characteristics of cancer cells, you can have autonomy. They have autonomy. They are independent from normal cellular controls because they're not attached anywhere, so there's no cellular control. There's anaplasia, which is loss of differentiation. Anaplasia means without form, if you translate that from the Latin. Each succeeding generation is less like that of the parent. You'll have altered stem cell function, which will lead to rapid growth of the tumor. Now, your stem cells are not at the end of the pathway of differentiation. Normal stem cells are at the beginning when they decide, do they want to become a bone cell, or do they want to become a brain cell, or do they want to stay a stem cell? The nice thing about stem cells is they can divide without limit. And when they divide, each daughter cell has the choice to remain either a stem cell or to go to terminal differentiation and decide to be a bone cell or a heart cell or whatever kind of cell. That's what's so nice about stem cells. That's why the stem cell research is so very important, because they're looking at taking stem cells and implanting them into myocardial tissue that has been somebody who's had a heart attack, to grow new heart cells. They're looking at taking stem cells and injecting them into the spinal column to grow new nerve cells in somebody who has spinal cord injury. They're looking at taking it and putting it into the brain to help with patients who have Parkinson's disease or Alzheimer's. So stem cell research is the wave of the future, and is going to be involved in a lot of different diseases, including diabetes, among others. So you'll hear a whole lot more about stem cells over the next 10 to 15 years, I'm sure. Tumor cell markers are used to identify the tissue of origin of a poorly differentiated metastatic tumor. Tumor cell markers require retention of some of the characteristics of the parent tissue type. They can use either enzymes or proteins, most often as your common markers. They are used to screen and identify individuals at high risk, to diagnose specific types of tumors, to follow the clinical course of the tumor, or to do research. Tumor cell markers, for example, might be your thyroglobin protein that's specific to a thyroid tumor. Cancers are based on symptoms. The markers are used to prove the disease, but you cannot use them alone to diagnose the cancer. You need to also do things like biopsies and or x-rays. These are found in blood, spinal fluid, or urine. Different types of tumor cell markers. It could be hormones. Hormones may produce excessively high levels. For example, insulin, if you don't have enough or have a problem with it, you may have pancreatic tumor. ACTH could be a lung tumor. HCG is your human gonadotropin, and this would be a tumor of your reproductive organs. Calcium would be a tumor of your parathyroid gland, which is responsible for calcium regulation. PSA would be specific antigen for the prostate gland. And if it's elevated, it can indicate that you have prostate cancer. Now, these are not 100%, but they do give you a strong indication that that is the problem that's going on there. Enzyme abnormalities could be either an immature or fetal form of the enzyme. It could be an ectopic production of that enzyme, or the enzyme is there in abnormal amounts, either increased or decreased. Gene therapy, or genes, identify specific genes that cause a problem. For example, the p53 gene on chromosome number 17 in healthy adults activates the cellular defense mechanisms against cancer. If that's not present, or if it's defective, the person develops cancer. So it's your cancer suppressive gene. Antigens see ourselves as a non-self problem and attack our own body. And antibodies can also cause a problem. The guardian of the cell. This is showing your p53 gene. Every human cell except sperm, eggs, and blood vessels contain 23 pairs of chromosomes. You already know that. The p53 gene is located on the short arm of chromosome number 17. And if it's healthy, the cell protein produces a factor to make p53 protein and blocks cancer. It takes care of it. The p53 protein locks onto the genes, activating the cellular defense mechanism. This is from a Newsweek article, this diagram. Oncogenic viruses are viruses that predispose someone to cancer. You've got your hepatitis B that can cause hepatocellular cancer, or your Epstein-Barr virus that can cause cervical cancer, or Burkitt lymphoma. You've got your DNA virus, which is your hepatitis B or your Epstein-Barr. You've got your retrovirus, which is an oncogenic RNA virus that contains reverse transcriptase enzyme, which aids in forming viral DNA. It alone cannot cause cancer. It must have further changes or exposure in order to cause the cancer. HIV in your B-cell lymphoma has been implicated to cause cancer, and in Kaposi sarcoma. Herpes simplex virus has been implicated pardon me, in anogenital and oral cancer. And the human papillomavirus has been shown to cause cervical cancer, and there is a vaccine against it now. There's a table on page 236 that shows further information about viruses in cancer. Immunology. Cancer cells express tumor-specific antigens which are not found in normal cells. Antigens allow the immune system to destroy the cancer cells unless they're immunosuppressed. This is caused by loss of your plasma membrane components, release of your intercellular components, biochemical modification, and chronic inflammation. Bacterial causes of cancer. One is H. pylori. It is a major cause of gastric lymphomas and carcinomas. It tends to occur more often in blacks and Hispanics. Tumor metastasis occurs by direct invasion of your local areas. This is your step 1 in metastasis. After it directly invades, it then metastasizes or spreads by way of the blood and the lymph system. And then can be implanted somewhere else. For example, when physicians open and close someone who's got cancer, the reason they close is because they fear if they cut into that cancer, all they will do is spread it further by having the cancer cells on their knife going to other tissues. You may have mechanical invasion that causes pressure on the surrounding tissue. This is step 2. In this stage, you'll release lytic enzymes to destroy your normal tissue. It causes a decrease in cell adhesion so the cancer cells can spread easier, and it causes an increase in motility of the cells. The theory of invasion in 3 steps. The first is attachment to a cell matrix. The second is dissolution of that matrix, and then movement through the basement membrane with the development of pseudopodia, which are finger-like projections into that tissue. Then you have metastasis, which is seeding of the cancer elsewhere. You'll have lymphatic spread, which is the most common route. But in order to do that, you have to have an adequate blood supply. And angiogenesis is the production or development of a new blood supply just for that cancer. Again, this is looking at the pathogenesis of metastasis, where up at the top you have your primary malignant neoplasm that goes, you get revascularization, so you form your new blood vessels, your angiogenesis. Then you have invasion of your lymphatics into the blood vessels, into the venules and capillaries, that transport it along the blood vessels elsewhere. So this is going into the lung, where it adheres to the tumor cells, and then escapes from that vessel into the extravasation, and then you end up with tumor cells all over the lungs. It has metastasized. Environmental risk factors for cancer. You could have your personal behaviors. Smoking, diet, increased weight, alcohol, sexual and reproductive behaviors. Your diet, particularly in women, if your dietary fiber is low, you're going to have more colon cancer. If you have a higher dietary fat, you're going to have an increase in breast, ovarian, and endometrial cancer. If your weight is up, you'll have an increase in endometrial cancer, particularly. Alcohol, cancer of the mouth, esophagus, liver, tends to be greater in women because they have a greater sensitivity to alcohol. Sex. An increased incidence has been shown in cervical cancer with an earlier age of intercourse and an increased number of partners. So there really is a reason for abstinence until you're married. Air pollution, increased lung cancer due to radon gas that's out there. Your occupation, you could be exposed to asbestos, which increases lung cancer. Exposure to chemicals that increases bladder cancer. Pardon me. Ultraviolet radiation causes basal cell and squamous cell carcinoma. Ionizing radiation from the A-bomb or X-rays cause the atomic bomb, or X-rays cause the leukemia or other cancers. Electromagnetic fields, your cell phones, are being studied as a possible increased risk for cancer. Exercise tends to decrease the risk of cancer. Smoking, it includes secondhand smoke, increases your risk for cancer. Your symptoms, the most common symptom, absolute most common, is fatigue. Pain rarely occurs initially, but does occur in about 60 to 80% of all terminal cancers. Cachexia is a syndrome of symptoms that includes anorexia, which is a loss of appetite, early satiety or early fullness, weight loss, problems with taste, altered metabolism, and asthenia, which is a very marked weakness. Cachexia is closer toward end stage, or when the cancer has more of an advantage than the treatment does at that time. Anemia, 20% of the patients will have a hemoglobin of under 8 due to bleeding, malnutrition, and treatment. This is treated with epoetin, erythropoietin, which is normally secreted by the kidney to stimulate bone marrow production. Not enough is produced, and we can give it exogenously as epoetin, Procrit. There are a couple other names I can't think of offhand, but they stimulate red blood cell production. Transfusions are not being done any longer unless the patient's symptomatic and the hemoglobin is around 6. Thrombocytopenia is a decrease in the number of platelets, so your patient will bruise and or hemorrhage faster. Infection is the main cause of complications and death in cancer patients because they are immunosuppressed because of the medication treatment regimen. And they also develop paraneoplastic syndromes. There's page 257, table 10-4, for information about your paraneoplastic syndromes. Inherited cancers are cancers that are due to occur during gestation and birth. A cancer oncogene can be inherited, and an example is Wilms tumor, which is a childhood cancer of the kidney, or a retinoblastoma, which is an eye cancer in children. Both of these are due to a problem with your tumor suppressor gene. Breast cancer can be inherited on the BRCA1 and the BRCA2 gene. And some women who carry those genes have decided to have bilateral mastectomies to prevent the onset and risk for breast cancer. The only problem is, unless you remove every single cell of breast tissue, the risk for breast cancer continues. One of the actresses that's on television right now just had a bilateral mastectomy, Christine somebody, because she carries those genes, and she had a family member who had breast cancer and did not do well with it. Childhood cancers are the second leading cause of death in children over the age of 1. The more common types are your leukemias. 1 out of 3, or 1/3, are due to leukemia. Brain tumors are the next in frequency. Sarcomas and embryonic tumors diagnosed before or equal to the age of 5. We may have a neuroblastoma, which is a tumor of the sympathetic nervous system, or rhabdomyosarcoma, which is a soft tissue sarcoma of your striated tissue. Osteosarcoma and Ewing sarcoma are bone tumors in children that might occur. Carcinomas are rare in children as they have a decreased environmental exposure, and that environment is necessary to help increase the risk for cancer. Childhood cancers are usually very fast growing, tend to occur more so in whites. They're probably due to a combination of genetic and environmental factors. If you can have trisomy 21 or Down syndrome, you have a 10 to 20 times greater risk of leukemia before the age of 5. Wilms tumor is associated with other genetic abnormalities and radiation may increase the risk of childhood cancer. You have a greater risk if you're immunocompromised or have prenatal exposure to carcinogens. For example, diethylstilbestrol, or DES, caused an increase in vaginal adenocarcinoma in children of women who took the drug to prevent spontaneous abortions. These cancers are diagnosed during peak times of growth and maturation. Prognosis of childhood cancers tends to be much more favorable than adult cancers, and survivors are at an increased risk of cancer in later life, so they continue to need to be screened as they age. And that finishes the biology of tumors.